Sir, welcome to the I was gonna say welcome to the show, but welcome to the conference. What I've been doing, first off, I don't have a camera working today, so we're just having all kinds of fun tech issues, but I am not going to introduce you. I'm going to let you give your own introduction, but I just want to read Travis in by saying how excited I am that he's joining us. I spent 8 years in the Army Reserve, so I did not have nearly as many ribbons as Travis does, but it was incredible for my career. It really launched a lot of it, including paying for my doctorate. But then also my wife knows Travis through Lynchburg University, and they both have a passion for global health and I think doing things in locations of the world that don't make me feel very comfortable, but I'm excited for that as well. So, Travis, I'm going to give it to you, but thank you so much for joining us. And I can't wait to hear about your experience with the military, but also how we can see the military as a way to accelerate our careers.
All right, team. So thanks so much to Michael and White Coats of the Roundtable for having me this morning. I am very excited to be here. This is going to be a really good, feel-good presentation, just talking about benefits of military service as a healthcare provider. And I just want to share my story with you. I currently serve with the 4th Security Force Assistance Brigade out of Fort Carson, Colorado. I'm in the U.S. Army. And I also teach at the University of Lynchburg's Doctor of Medical Science program. I lead the Emergency Management and Global Health concentration. So for me, I have 25 years of active duty service, and I've been a PA now for the past 13 years. I went to the Inter-Service Physician Assistant program, married for about 18 years. And you're going to hear me say this about a million times through this presentation. Military life is a family business. Something you've been thinking about doing, obviously you need to get your family on board because for me personally, I've lived in 10 different duty stations. I've had the blessing to do 8 combat deployments, including about 3 deployments over to Eastern Europe in response to the current issue that's going over there. I've been able to advise 17 different countries across 35 nations on best medical practices, global health, and trauma evacuation and care. I have 2 awesome kiddos, and there's pictures of them there. That's when they were younger when we lived in Washington, D.C., and then now they're a little older here in Colorado. Like I said, my specialties are emergency medicine, global health, and austere medicine. I did get the pleasure of getting to work at 5 years as a White House PA, so I'll go back to that experience quite a bit today just to talk about that because I want to share my story and why it's awesome to be a military healthcare provider. And like I talked about, I did the last 3 years, I spent really in the global health engagement realm, helping Eastern Europe really increase their medical capability and capacity in response to what's going on over there right now. I am an assistant professor at University of Lynchburg, and then I'm also serving as the director at large with Colorado Academy of PAs. I was just elected to the president-elect of the Society of Army PAs. I feel like that might have been a voluntold position, but I'm super excited for that. And then I serve with SIMPA, AAPA, and the Wilderness Medical Society as well. And my hobbies, I like to do everything that pretty much injures an over 40-year-old. I live in Colorado, so skiing is a must. Okay, next slide. All right, so the objectives we're going to get into today is I really want to get after the unique skill sets developed in military healthcare. That's going to be a really important one today because I want to show you, like, if you come in and you want to be a military PA, a physical therapist, a nurse, you really get to develop some unique skills that you may not get to develop so much just working as a civilian PA. And then we look at the professional and personal growth opportunities, and there's so many, not just on the professional side with education, but there's also some really good financial and educational benefits. And then last, just appreciate the broader impact on the community and global health. So that's really an important part as well. So we're going to look at the total soldier and the total, what it means to be a service member. Okay, next slide. All right, so what we're going to talk about today, we're going to actually talk about why this topic matters, like why am I here talking to you today, some requirements and areas of practice you get the pleasure to work in, a deep dive into those unique skill sets, look at the really great personal and professional growth opportunities, the broader impact, and then the overall value of a military medical service, and then some contact information. Okay, next slide. All right, so why this topic matters, right? First, to me, you get to serve your country. I mean, what better ways to serve your country? And for me, I get to serve the most important people in the United States of America. I get to serve the active duty soldiers the Marines. I get to take care of sailors, our Space Force. I get to take care of service members, people, Americans that have volunteered their life to serve the country. And so for me to be able to take care of them, that's amazing. And I had these pictures here because I want to show you. I'm going to have a lot of cool guy pictures where we're doing a lot of stuff in combat zones. But, you see me there in the white coat. The general day-to-day is usually just like every other PA. You're in the clinic, family practice, taking care of your fellow soldiers, making sure they're healthy to stay fit. And we get to deliver comprehensive care. So not only are we taking care of those soldiers, but we take care of their families and the retirees. So what's really amazing about that, if you're keeping the family happy, keeping them healthy, the soldier is going to do really well to keep their mission going. And then global impact. We practice across many countries, which really enhances your culture and your global health experience. So your culture competence, right? So if you've ever wanted to travel the world, the military is the way to do it. That picture up there on the left, that's actually us over in Estonia, war and disaster medicine, training Ukrainian soldiers. Over the past 3 years, we've had the opportunity to train many of those soldiers to be combat medics, and they're literally going right back into combat. So we've had a piece of really making a global impact, saving lives in that current conflict. So something I take a lot of pride in. And then cross-functional expertise. And when I say cross-functional expertise, you'll see that picture there down to the bottom left. That was from my time at the White House. So not only do you get to be a better professional as a provider, but you learn how to lead, train, and do all kinds of different missions that maybe if you were, in the clinic, because this subject of this presentation is beyond the clinic, right? A lot of things different that you get to learn and be a part of. And then unmatched scope of practice and patient-centered care, right? So we conduct over 40,000 patient visits. And when I tell you that PAs are the backbone of the U.S. Army, we're going to get into that presentation, but PAs really are the backbone of the U.S. military. And then that patient-centered care. So what's really cool, and a lot of you may love this, you get to practice without the limitations of a patient's ability to pay. That's part of their services. They get that military health care. So you get to focus solely on providing the best care. And then you don't have to concentrate so much on insurance, which is something I personally love. Okay, next slide. All right, I'm not a military recruiter. I want to throw that up here. I'm not a recruiter. So I just want to take the time today and share my personal experience, my military journey, and the medicine and the role my family has played in supporting it. Some amazing opportunities, because there are some really unique, life-changing paths the military service can offer you. It's definitely offered me. And I want to give you some inspiring stories. I want to highlight my experiences and those of some amazing, exceptional PAs who really embody the spirit of service and just really getting after it and being exceptional. And then last, the benefits of service, explore those professional, personal, and global rewards of serving in the military. And I love to share this picture right here, a little icebreaker. So this was like my first probably 2 months in the White House Medical Unit. And at the White House Medical Unit, the PAs are actually many times the sole provider for the vice president. So when you see the vice president traveling all across the United States, the PA is the senior medical provider with a nurse traveling with the vice president, which is pretty amazing. And with that, you get to know them pretty well and their family, and they invite you to the Christmas parties. And this was the first year. Now, mind you, our family lived in Hawaii for about 5 years. And if everybody, if many people know you live in Hawaii, everybody does the shaka, right? So it was like ingrained in my pictures to do the shaka and pictures. So we always love to tease my son with this picture because he's throwing a shaka in the middle of this picture with the vice president of the United States. So just a fun picture. We always like to tease him. And I can add it to a lecture, which is a great. But I tell you all this because, like I said before, military lifestyle, it is a family business. So keeping the family on board and making sure that they can adapt and just be happy with the ways that you're doing things and traveling, that's really important. Okay, next slide. All right, so we'll talk about some requirements to be a PA. We're going to hear me say physician assistant 65 Delta. 65 Delta it's called the AOC. So it's your component. You might hear the word MOS. And this one's specifically for active duty or regular Army. You're going to hear me throw those two words they're both one and the same. So active duty is what I do. I go to the Army every single day. It's my job. We also have the Army National Guard and the Army Reserves, which is 1 week in a month and 2 weeks a year, so if you're thinking about dabbing your feet in the water, but you don't want to go all in, The Army Reserves is a great way to think about it. And Michael, you were talking about that, the Army National Guard. And the mission sets are a little bit different. But to be a 65 Delta regular Army PA or an Army Reserve, there's boards every month. So if you want to board, and then applicants, you must have that certification from NCCPA. So that's super important. Obviously, that's with just about any job we have. You have to be an NCCPA certification. And then this is kind of an interesting for us. We're thinking about moving this around, but right now a state licensure is not required. And that's actually true for all federal PAs. So if you're thinking about working in the State Department, you're thinking about working in the Central Intelligence Agency, the U.S. State Marshals, for federal PAs, state license is actually not required. Now, it does become a little bit of a difficult if you are trying to call off prescriptions off post. So for me personally, I get a state license wherever I live. And then when I worked at the White House Medical Unit, we travel to, every state, and I had to call in license. So I think I have like 12 state licenses. So I really want to thank the AAPA for getting the compact licensure and getting that across the board, because it saves from not having to have so many licenses. And then other Army applicants within 6 months of graduating from PA school may apply. So that's pretty neat. So if you have PA students that are about to graduate and they thinking about active duty service, they can start applying now within 6 months. And you just have to provide a letter from the institution identifying their standing and their projected graduation date. So that's really important as we get into some of these next qualifications. Okay, next slide. And then the requirements for a physician assistant 65 Delta. So this is the Army Reserve. And I didn't note it on the last slide, but a commissioned officer. You also come in as a commissioned officer, traveling from Virginia back to Colorado, a little different allergies. Okay, so some eligibilities to think about there. Same thing, you got to be certified by the NCCPA. The difference here is you have to have 6 months of service. And the reason for that is when you come into the regular Army, we're going to put you through a lot of training at first to get you up and running as not just a military healthcare provider, but also as a leader. You got to learn how to be a military leader at first, which we're going to get into. But on the reserves, you may go right into your job and your training. Your training may come later for that leadership. You do have to be a U.S. citizen, and you must meet the medical and physical standards. Okay, and then it gets in here to why do we serve, right? So like I said earlier, you get to serve your country. You get to take care of some of the most important people of the United States of America. They volunteered their time to serve, and that's what we're going to get after it. Now, another slide that I want to talk about while we're sitting on this one is age limits for officers in the U.S. military. So there are some age limits. So if you're thinking about the U.S. Army as a commissioned officer, 35 years old is going to be the age limit for that. If you're thinking about joining the Navy or the Air Force, the Navy is 41 years old and the Air Force is 39. And then lastly, the Coast Guard is 41 years old. So just things to think about if you are thinking about joining the U.S. military. There are age limits, but it's pretty high. So, if you're sitting at 30 years old and you're thinking, I'm too old to join the military, you're actually not. Okay, next slide. All right, so areas of practice. This is where we get into the fun, exciting stuff. So when you generally come into the U.S. military, you're going to generally be a family medicine. You're going to get assigned to a cohort of about 800 patients. That's your panel. And it could be light infantrymen. When I say infantrymen, that's the title, but it is men and women. You could be with fire support, and these are soldiers that shoot for fires. You could be assigned to a Navy ship. You could be assigned to a battalion of U.S. Marines. The only spot where we're not in a lot right now is the U.S. Space Force, and that's because they don't have a medical force just yet in the Space Force. But you are always family medicine. But you notice right underneath that, I have trauma medicine as well. You are an expert in both of those, and we don't just throw you in and say, hey, you are now the trauma expert. Good luck. No, what the military does is you already got your PA qualifications. We know that you know how to see patients and take care of the day-to-day stuff. But when you first come in, we put you through that leadership training, and we make you a trauma expert. We put you through tactical combat casualty care and tactical combat medical care. Tactical combat casualty care is just the general principles that we teach our medics. It is pre-hospital medicine. So if a soldier has an improvised explosive device, a soldier takes a weapon, or maybe a soldier falls off the top of, maybe a 2-story building, or has a really bad fall from an airborne jump. Tactical combat casualty there is for you to do that pre-hospital medicine and know how to treat them, but it also helps you get developed so you can train your medics, which we're really going to get after. And then tactical combat medical care is all of your equipment that you get as a PA. So what's really awesome, and I could speak mostly from the Army side of the house, whenever you get signed to a unit, you got this equipment called a sets, kits, and outfits, and it's got ultrasound, it's got your AED, it's got all your trauma gear, it's got stuff for field sanitation, and it's got your general day-to-day family practice gear. And this is all gear that's given to you, and then you also get issued about 50 medics that are yours to train, to learn, to take care of. Now, they have a basic EMT qualification, but it's up to you as the PA to train them. So that's why we have the tactical combat casualty care and the tactical combat medical care, to get you trained up for the equipment and how to take care of those medics, so you can be a good workforce for all those soldiers you're going to take care of. So family medicine and trauma medicine is generally where you start. Now, we have some health education, which I'll get into a little bit more, but you can work in emergency medicine. You can work in orthopedics and general surgery. And these are actually all doctoral programs that we offer PAs that join the U.S. Army and the U.S. Navy and the U.S. Air Force. And I think there are some Coast Guard as well. You can work in behavioral health. And then these are actually generally jobs that are actually pretty available to almost all PAs, is aviation medicine. If you'll see my credentials, I am a aeronautical PA, APAC. So I went through an 8-week course that qualified me to be an aeronautical physician associate. And what that means is I learned how to work inside as crew of a helicopter, so I can do my medical care inside of a helicopter. I take care of all the physicals. So if I am assigned to a combat aviation unit, I do all the physicals for the pilots to make sure that they're fit to fly. On the Air Force, the same thing. Those PAs, they do all the physicals for the fixed wing aviators. So it's a really great job, and it's generally open to everybody as long as you're willing to go to get that training. So it's pretty amazing. That's not a field I think a lot of PAs on the civilian side get to work in. And then that goes over to dive medicine. And you'll see that picture to the left. That was me actually offloading a patient. And we were actually working with a Romanian infantry unit. And I was doing medical care inside that helicopter. This is all training, offloading the patient and giving them a report. So really get to do some extraordinary things. You actually do get to fly the helicopter in a simulator, and they do some emergency operations in the helicopter where you do get a chance to fly. So if you ever thought about flying a helicopter in an emergency situation, there's your chance. And then dive medicine, that's another one. So up top there, we have a hyperbaric chamber, and those are Navy divers. I actually started off my career as a U.S. Army diver. But you do have the chance to go to dive medical officer training or hyperbaric officer training. So these are generally open to all PAs, which is pretty amazing, right? So you come in, you do a couple years as family medicine, you're that trauma expert, and then it's like, hey, I want to go to be an aeronautical PA. The military will give you that opportunity. And not only will you get that training, but you will be assigned to a unit where you take care of aviators, which is pretty amazing. For me as well, I was assigned to a combat aviation unit out of Schofield Barracks, Hawaii, where we deployed overseas. And then when I got to the White House, I took care of many of the aviators that were for Presidential Airlift Group, so Air Force One, as well as HMX-1, which was the helicopter. So really just a great opportunity if you're thinking about something different out of the box. Now you'll see there at the bottom, I highlight combat medic training. So this is something that we really talk about that's really important as a military PA. So can you go to the next slide? So combat medic training, and I want to hit on this a little bit because this is one of those benefits of being a military healthcare provider that I'm super passionate about, and that you get to be an expert and help. So like I said, you get these different medics that they have EMT basic, they may have tactical combat casualty care training, and they come to you and you're the senior PA that is in charge of training them. So you get to train them on the tactical combat casualty care, the prolonged field care. So right now we're looking at different operations where, if we do have to go what's called large scale combat operations, we may have to hold on to patients a lot longer And so we are training them to hold on to patients a lot longer. Now, what's really amazing about this is you get state-of-the-art equipment. You may even get new equipment to try. When we get into that, we talk about our evacuation medicine. We're talking about not only evacuating by an ambulance, a helicopter, but looking at evacuating by drones, okay? And then we're looking at the whole blood training. We are as far forward. I'm sure many of you are starting to see whole blood in your ERs. That pretty much started with Chris Cordova. He was in Afghanistan. He was the first PA to actually draw whole blood from himself and a couple others to save lives of soldiers. That is regular training that we are doing with our medics. And you as the PA, you get to be in charge of that training and designing new opportunities and new technology. So that kind of stuff is really exciting to me because you really get to be the tip of the spear. Point of care ultrasound, and we're going to get into that fellowship. And then global medical partnerships. You get to not only train your medics, but in some positions you do, actually almost all of them. We have soldiers right now in Poland and Romania. And those PAs over there are teaching Romanian soldiers and Polish soldiers on medical healthcare practices, evacuation, this prolonged field care we talked about, ultrasound. So just really, really get to be in there and can be innovative. And then lastly, moral leadership and combat medicine, right? So for me, I deployed to Iraq. And when we did have those major traumas, it was my responsibility to debrief those medics, the commanders, and make sure that everyone understands the moral leadership in combat medicine because it is important. But I just really wanted to share that because not only are you coming in, you're going to be a family practice PA, you're a trauma expert, but you get all these amazing young medics, and most of them are from the ages of 17 to 25. Some of them are going to college. You may mentor them to become PAs, nurses. So for me personally, I've had 3 of my medics become physical PAs, one a physical therapist, one a scientist, and one a physician, which makes me super proud because I was able to mentor them from 18 years old to now. So just something to note if you're really interested in leadership and training the next generation, that's something you get to do as that PA with those combat medics. Okay, next slide. And then other areas of practice. So these are the special assignments. So if you really want to, you could be with special forces and you will be that PA that supports those special forces. You're not going to be the person that goes and kicking in the doors or shooting the enemy. But you're going to be taking care of those special forces soldiers, and you're really going to be innovative in how you do it. So for me, I've worked with the special forces and I've worked with the Rangers. You get extra certifications in dry needling, battlefield acupuncture. I am credentialed to do Botox for migraines. Because really what they want you to do as that PA with those kind of units, you kind of have to be a jack of all trades. So if you're really interested in doing some of those special assignments, you can do the special forces. I'll talk about Alvaro Ramos. He's one of my colleagues from the White House. He's about to retire. He got to serve with the Navy SEALs. Civil affairs is a really interesting one, right? So with civil affairs, you are taking care of those soldiers, but you will be part of that mission as well as being an advisor. You will go forward. You will talk with local nationals and try to win those hearts and minds to kind of work with us in the U.S. military. And from our point of view, a lot of that's looking at healthcare systems and how can we influence those healthcare systems to support us. So when I say that, you're really working as not just that healthcare provider, but you're also a U.S. diplomat. You got to use your diplomatic brain, and we give you training for that. So just some really outside the box. And then lastly, the White House Medical Unit. You can see some pictures there. The bottom picture to the right, that's when I actually got back from, I think it was Hurricane Maria in Puerto Rico. And it was one of the first times I had done a disaster mission. So I really got exposure to disaster medicine, how that healthcare goes. And up left is the ambulance we got to work out of. So when I say outside the box and beyond the clinic, you're going to get the skills to work not only in airplanes like that, but how to work in the back of an ambulance and how to function, but also train your medics to function in that practice. And then lastly, I got IPAP there. That's the Inter-Service Physician Assistant Program, and that's our education side. So you come in and you practice for about 3 years, and you really decide that you want to be in education. Another special duty you can do is teach with the Inter-Service Physician Assistant Program, which is an amazing program. And you can also be an educator with the combat medics at the schoolhouse. So there's a lot of opportunities where PAs really are the leader and the lead educator. Okay, next slide. All right, some unique skill sets developed in the military. This is where we're going to get after that first objective. And you'll see these two PAs here. These are two amazing PAs that have a lot of influence in my life. On the left there, that's Colonel James Jones. Many of you may know him. He was the medical director for our innovation division. He was a public health director. I got to serve with him at the White House for about 8 years, and he's just now taking over director of the White House medical unit. So when I'm saying PAs in the military are in those director, those CEO positions, they really are. But they got there because the military gave them this training. And that's what I want to talk about, that leadership and teamwork in critical environments. So when you're in those combat situations, they really do teach you how to lead under pressure in those high stakes, austere conditions, right? But that's not what you're doing every day. We're also looking at the executive level. As a PA, and you're out there with that unit and you have those 800 panel of soldiers, you also have a commander, and that commander, that's the CEO of that company. You're briefing that commander on the health and welfare of these soldiers, the operational levels of medical readiness, maybe strategic planning for where you would want to put different medical entities if you do have to deploy. So you learn a lot about managing teams and operations at strategic levels. And that's what I want to talk about. The gentleman on the right, that's Bernard Tony. He is a retired U.S. Army officer. I had the pleasure. We actually grew up together as PAs. We were in Hawaii together. And then later on, we served at the White House Medical Unit. And Tony now is a U.S. diplomat and works as a foreign service medical provider with the State Department. And so that shows you the skills that the military develops in you to go on to be these higher executive levels that we all strive to be as we want to be those PA leaders out there. Now, when we talk about leadership training, and I talked about some of the professional development, but when you first come into the military, you get to go to a basic officer leadership course, or basic training, right? Now, when I say that, it's not the kind of basic training where you see our younger enlisted soldiers going to. It is somewhat physical, but it really is teaching you how to learn how to be a military soldier, how to wear your uniform, some physical stuff in there, and then also about the medical healthcare system. Because believe it or not, the military medical healthcare system, I believe, is the second largest compared to the VA in all of America. So really something you have to learn about and be a part of. But it also teaches those basic leadership skills. I don't think there's a lot of civilian jobs where they bring you in and they teach you about leadership, which is really great. Because as you progress in your career in the military, they get send you to captain's career course, and that's more advanced tactical and organizational leadership. And then as you advance to your major and beyond, you go to intermediate level education, and that prepares you for executive level and decision making. And alongside those schools, these leadership schools, the ILE is about a year long. You can earn another master's degree in leadership. So there's a lot of opportunity, not just to grow professionally as a medical provider, but also as a healthcare leader, because you make a decision at one point. Maybe you don't want to work in the clinic anymore, and you do want to work in the C-suite. You do want to be a director of something. So that's really what the Army does. It doesn't just say, I want you to be a medical provider, go in the clinic and see patients. No, the military wants to develop you as a leader because they really want to groom you later on to take higher positions. And that's going to take me on to our next slide. Okay, so this is General Bill Solis. So General Bill Solis, he's actually our first active duty general PA. And he was a CEO of a hospital at Triple Army Medical Center, and now he's the consultant to the Army Surgeon General. So it goes to show he came in the military as an enlisted medic, developed himself over the years as a leader and as a medical professional. Went to IPAP, commissioned as an officer, and through those leadership schools, different assignments and learning, was able to become a general. That picture on the bottom, that's him at the White House Medical Unit. He was a little bit before my time, but he served with President Bush. But I want to tell you this story because these are the benefits of being that healthcare provider, the different areas you get to work in, right? When we talk about those high stakes decision making and adaptability, right? So you really learn how to critically think under pressure, how to learn how to be adaptable in those dynamic environments. And you take it all in real world application. It's not just theory. We put you through these schools and you've learned. We put it to work, right? So, in the extreme environment, it's managing triage and mass casualty incidents, say you're deployed to Iraq, or it could be a training iteration like our soldiers are doing now in Poland and Romania. they're not only making decisions in training environments, but they're also teaching their global partners that they're stationed with right now. Or thinking about leading medical evacuation operations under fire, right? So, those are very extreme when we think about combat operations, but those leadership schools, they groom you to learn how to do that. And then you put it on, you put it to practice, and it really helps you make decisions later when you do want to do that hospital CEO job. And some other positions I want you to think about that PAs are taking. We are the combat surgical team leads nowadays. We are commanders of different units. Like I talked about, Colonel Jones, he was the commander of the Public Health Command, which is pretty amazing, right? When I say surgeon, right? So surgeon is what we call battalion surgeon, division surgeon, or brigade surgeon. And what that means, that's really just a title. You're not a surgeon, but you are the leader. So within a brigade, you're going to have about 7 PAs. And if you become the brigade surgeon, you will be in charge of those PAs like the lead APP, right? And that's why I call it the division PA or the brigade PA. So, and then as you go up, the division is more like 20 PAs, and you're in charge of all those PAs. And I'm telling you that because if leadership is something that you're very much interested in, as you make rank in the military and you go up in positions, you have those chances to be that leader. It's not really like you not have to fight for it. Those positions are already there for you, as you just have to want to do them and take that training. So really just some amazing leadership opportunities that you can take advantage of in the military. Okay, next slide. And then some more of these unique skill sets, right? So this is Sabatu Manzure Knight, and she's an amazing PA to highlight. She was the first female PA to work at the White House Medical Unit. She actually became the first medical person to be the military aide to the vice president for Vice President Biden, and then later on became the operations chief for Vice President Pence, and now she has her own nonprofit in Africa. So just saying that because the skills that she developed over her military career enabled her to do these amazing positions and keep moving forward. And it goes back to those basics, right? So that expertise in trauma care, emergency medicine, and resource limited settings. When you learn to work in that environment, it really develops your leadership and decision making skills. And we go back to the specialized training, right? So we talk about those different leadership schools the military can send you through, as well as the amazing healthcare and professional developments that we're going to get into. And then you become that subject matter expertise, and then global health engagements that last. So putting all that together, when you're going globally, and it's either going to be a combat deployment where you're making decisions in high stress environments, or you are winning the hearts and minds of our global partners so we can enhance their capabilities and capacities. These are all leadership and just cultural competency building onto you as a person, and makes you a better professional, not just as a PA, a healthcare provider, but just as a leader and just a human in general. Okay, next slide. And then some of these skill sets in action, right? So I had these slides here. We're talking about leadership. So you can see there on the bottom left. So that's Colonel Jones at the White House during President Obama's time. And he's that lead PA. It's not a doctor. It's a PA giving a brief to President Obama on the current situation at hand. So pretty amazing to see that. And those are those leadership and skills that you were developed. And then teamwork, right? When we're thinking about teamwork, we're looking at that picture up on the right. And that's us last year training Ukrainian soldiers how to be combat medics. And we're using our skills that we've learned, not as just as healthcare professionals, but as military leaders, to help them work as a team. And that's something that we really take a lot of pride in. The amount of teamwork and camaraderie you have is far above none. And then, of course, the medical care. That's Sabatu in Afghanistan giving medical care. And this goes to that global impact, right? So she is taking care of a local Afghan national, which is pretty amazing. Not too many chances, I think, in civilian healthcare outside of global health work where you can do this. And this is a pretty normal day-to-day mission doing this as a global healthcare provider. And then lastly, on the left, that was, I think in 2022, I had the opportunity. This was when I was traveling to all those different countries. I was teaching actually Polish doctors on tactical combat casualty care and trauma evacuation. So I just want to showcase these pictures because it shows these skill sets in action and how you can really use what you've learned and develop other global partners, take care of, those less fortunate in other countries, but also be that leader when you could be that leader that is, briefing the president of the United States. Next slide. All right, some personal and professional growth opportunities. So really want to get into these. These are kind of those the really fine details of everything of being in the military service. So the financial benefits, there are some really great salary packages, and you get tax-free allowances. So anywhere we live in America, we get a tax-free housing allowance, and it really goes by where you live. So if you're living somewhere like Hawaii, they will give you a tax-free housing allowance that is to pay for your house or give you base housing. We are not told we have to live on base housing. You can live wherever you want. So you can use that to buy a house, so which is really great. And there's really great retirement plans, educational benefits. So we're going to talk about those, but you have tuition assistance while you're in. You have access to the GI Bill, and then also those specialty trainings, which we'll talk about in the next slide. Professional growth, and we kind of cover that very much. Military healthcare providers, we get that really rapid career progression. You go from a lieutenant to a captain usually within about 3 years, and a captain to a major within about 6 years. But all through those times, you're getting more levels of leadership. So if you're like, I really want to be a leader in healthcare, the professional growth the military offers you it's probably hard to compare anywhere else. I mean, look at General Solis, CEO of the hospital, Colonel Jones, director of the White House Medical Unit, and then Bernard Tony as a U.S. diplomat working with the State Department. That professional growth is amazing. And then additional perks, health and dental benefits for providers and their families, lots of travel opportunities, and you really get a global network. That's one thing I think for me personally, I love my global network. So when I'm either traveling for work or I'm traveling for fun, I can call my buddy in Belgium or talk to my friend in Estonia when we can have dinner. That global network is really important, and I love that part. Okay, all right, next slide. All right, so financial. So this is the regular Army. When we talked about the regular Army incentives, we're talking about active duty. And I want to kind of go over this one because it's important. So if you decide you want to come in, you only have to do a 3-year obligation. And you can get a $37,000 bonus right up front to join. If you do 4, you can get $60,000. But the beauty of that, if you do have a lot of student loans, so also if you're an educator and you have students coming up, the active duty health profession loan repayment program, for that 3-year obligation, you get $120,000. That's pretty amazing. And note in that note there, if you can get both, so you can actually get the accession bonus. So if you do 4 years, $60,000, and then you can also get the loan repayment. Now that is an obligation of 7 years total, but you can imagine being able to pay back your student loans and you get a bonus. Now say you're a little older PA and you don't have any student loans that you have to worry about. There is also a $36,000 per year bonus that PAs get for a 6-year obligation. And they give us that bonus in the military because they understand there's a little bit of a salary gap probably between the military and the civilian world. So that bonus is there to make up for that. So it's a pretty great bonus if you're thinking about joining, serving your country. But having these money incentives are really good as well. And then there at the bottom, all military PAs get this. So just for being a certified PA and seeing patients, every PA gets a $13,000 a year just incentive pay. And it's broken into the months, but it goes because you're board certified and you're seeing patients. Because the military really recognizes the amount of responsibility that we have in seeing patients. And they recognize that and they give us that pay. Okay, next slide. And then the Army Reserves, this is the, if you want to join, and it's 2 weeks a year, 1 weekend a month, which is a really great opportunity as well. For a 3-year contract, you can get that $25,000 a year for a total of $75,000. And you can see there's those other 4, 5, and 6-year contracts. Or, which is amazing, the Health Professions Loan Repayment, you can get the $20,000 per year, a max repayment of $60,000. So what's amazing about that, you can join the Army Reserves, and you can do the 1 weekend a month, 2 weeks a year, and they are paying back your student loans. They will just ask you to give that service time. That being said, you can get activated to go active duty if you choose to for several years. So during COVID, our National Guard and our Army Reserve PAs were activated, and they were running a lot of the COVID testing labs across America. So you're also being a part of making a difference too. It's not just deploying overseas to help other countries. You do deploy here in America to help American citizens. And then as well, Army Reserves. They get the incentive pay as well, but it's prorated daily when they're on that active duty time. Okay, next slide. So this is when we talk about the long-term health education. I've alluded to this slide a little bit. These are all the different educations that you can take while you are in the military. And this is open to active duty. This is open to reserves, and this is open to the National Guard. And we call it long-term health education. But you can see there's a ton of them. Believe it or not, the U.S. Army was the first to come up with the DSC, the doctoral programs. So we do offer the EMPA, general surgery, and orthopedics. And when you go through those training in the military, it's completely free. You get paid as an active duty Army officer, Navy officer, Air Force officer to go to this training for 15 months. And when you get done, you graduate, you get your doctoral, and you will work in that facility. So you'll work as an orthopedic PA in a hospital. You're working as a general surgery PA in the hospital. You may even be in charge of a combat surgical team. And then the ERPAs, they are leading a lot of our ERs. They're leading a lot of our forward resuscitative surgical teams because a lot of times PAs, by this time in your career, you've not only had the leadership development, but you've also got this professional development as a healthcare provider. So they will look at you to be the leader, which is pretty amazing. We also do 1-year internships, which is with doing a POCUS fellowship. We do training with the industry, with the emergency medical technicians, also the American Academy of PAs, and then an executive fellow of the Corps Chief's Office. So that's working under the Surgeon General. So this is those opportunities where you're growing as a leader, but we make sure that you can grow as a medical professional as well. And none of this is charged. You don't have to pay for this education. It's part of being a military healthcare provider. So just really amazing opportunities to keep developing yourself educationally. Okay, next slide. So this slide just goes over that compensation package. So we're talking about the health insurance. So you and your family are covered with health and dental insurance. There is a life insurance, so it's pretty amazing. But you got to think about it. We do go to combat, so the military does offer a $400,000 life insurance for $29 a month, which is kind of an important thing if you think about it, because there are the risk of combat issues going on. Vacation, this is one of my favorites. There's 2.5 days per month, so you get 30 days of vacation per year, and you can roll that up to 60 days. So that's pretty awesome to get that compensation package right up front. Retirement incentives are pretty good. I personally will be retiring from the U.S. military next month, and I'll have a certain amount of my base pay that I have until the day I die. So that's pretty amazing. The thrift savings plan is like a 401k. And then lastly there, the VA home loan program. This is a pretty amazing program that you might only do a 3-year tour of service and get out, but you're a veteran for life after that. That's one thing I always tell anybody thinking about or on the ledge of joining. You are a veteran for life, even if you come in for 3 years. Your service is recognized by the VA in the United States. But the VA home loan program is great because you don't have to put anything up front for a home loan. The VA kind of spots you or just has your back on that, and you just you can get a VA loan, and the VA backs you without having to have that that 10 or 20% down. So just an amazing program to have that, and I've used the VA loan program for several years. Okay, next page. All right. And then our last objective here, we're getting onto that broader impact on community and global health. And this is the stuff I love. I think the military is why I got into the love for global health. But we're kind of looking at humanitarian missions and global health initiatives. So we're looking at that picture to the left there. That's Alvaro Ramos. He was a White House PA. He just retired. He was a Navy SEAL PA. Which just goes to show his really excellent career he's had. But he's there in the Philippines, and they are doing a global health initiative that the U.S. military sponsors because we do a lot of work in the Philippines. So if we're going to be there doing training with their local soldiers, we're also going to make sure that they're taken care of, their healthcare is taken care of as well. So these are great things to be a part of for global health initiatives. If that's something you're really interested in. Excuse me. And then as we're building on that, Alvaro is building on his cultural competence through these international collaborations, right? So the more and more you work overseas and you work with different armies, different air forces, you learn more about cultures, it really just develops your competence in those areas, which I think overall just makes you a better human. And then thinking about strengthening communities through disaster response and preparedness. This is really where we get into the Army Reserves and we get into the Army National Guard. That picture on the bottom left, that is the California National Guard. And that was them. That's a picture of them responding to the current California wildfire, which is pretty amazing. Like you join the military, you're in the National Guard, but you are serving your local community, taking care of, might be your neighborhood. So something to think about for the National Guard. On the right, I believe that was the New York, or no, actually that's the Colorado National Guard. Um, and they deployed to many of the COVID testing sites, vaccination sites, and taking care of the local community. So we talk about all these combat missions deploying over the world, but also showing how you can make a difference in your community. And then the top right, I believe that is actually a training exercise in Washington, D.C. But when I go down to those disaster response and preparedness, hurricanes, we respond, wildfires, tornadoes, but also executive level events. We just had the presidential inauguration. There are PAs out there in charge of these chemical biological teams, health response teams, special forces teams. There is PAs that are the leader of those healthcare teams all over for those executive level events. When you have a big concert, your National Guard may be activated for that. I hate to say it, when there's an active shooter response, the National Guard may get activated for that. And there's always going to be a PA there to take care of the healthcare and readiness of those soldiers that are doing that work. So just think about that broader impact of community and global health. Okay, next slide. This is some examples for me and the global impact that's really touched me. On the right there, that was the mission in the Philippines that Alvaro did. So you can see they're doing dental work there. Some of these children, they might not get dental care maybe once a year, and that's when you, as that military healthcare professional, organize that visit to do that. In the middle, that top picture, that was the NATO medical evaluation course. That's a chance when I got to train NATO countries from all over the world on how to be a medical evaluator. So something really special to be a part of that. On the bottom, that's working with North Macedonia and treating them on medical evacuation. And then the bottom left, that was teaching aeronautical PA skills and aviation, medical evacuation to Portuguese, I believe it was Czech and Romanian soldiers. So just goes to show the global health impact and how you can change the global aspect as a healthcare provider. And then lastly, that is actually a Ukraine refugee. We did respond to the Ukraine refugees on the Romanian border, and I was visiting this Ukraine refugee center, and this was just a little girl showing me her pet. She didn't have any parents, but we were able to make a difference in some of her health care. So just something amazing to think about how you can make a difference globally as a healthcare provider in the military. Okay, next slide. All right, and then the value of military service. This is just kind of bringing it all together. So we really talked about those unique skill sets, that resilience, that adaptability, and leadership. You're becoming an amazing healthcare professional, but you're also developing yourself as an adaptable, resilient leader. Those personal and professional growth, get all that education. There's great financial incentives up there, as well as career advancement. I guarantee you in the military, you're going to advance in your career because it's just the way the system is set up that you will advance. You'll go to these leadership schools and you'll develop yourself. And then the broader impact, the feel-good stuff that makes you feel good, that broader impact. And I love to share this picture. This was our team at the White House Medical Unit with President Obama. And I got to think that over my 5-year span there, I went to 42 different countries. We responded to disasters. We had some of those issues during COVID, and we were able to make a difference. And it was working as a team to make that difference. So very special. And it goes down to that quote by Nelson Mandela: what counts in life is not the mere fact that we have lived. It is what difference we have made to the lives of others that will determine the significance of the life we had. I think that's a great quote. And it really, for me as a military healthcare provider, it helps me look back at the military service and what's important to help the lives of others. Okay, next slide. And any interested PAs, if you thought about it, there's a website here, and I know we'll be sharing the slides, and you can talk to a recruiter. They're going to be a lot more smart on all those financial incentives than me. I really just wanted to share my personal experiences and some of the amazing PAs I've had the chance to work with. And then next slide. And this is my contact information. So if you have any other questions about some of those personal experiences, feel free to contact me on LinkedIn. You can shoot me an email. I'm happy to discuss them with them. I love talking about healthcare service and the amazing professional and just personal experiences that you can have. So thanks so much for your time.
Well, thank you, Travis, so much. At least a few minutes, so I want to get at least a couple questions in here for you. So we'll start with this one from Jennifer. Are there similar opportunities for NPs in the military?
Oh, no, yeah, I love that question. No, absolutely. So MPs and PAs, we're all advanced practice practitioners. So when it comes to those leadership schools, exactly the same. You have those same leadership opportunities, and you can come in. The nurse practitioners, we do have some that are working in those leadership positions on the line. We see them a little bit more in the hospital, but the nurse practitioners are working a lot more on those lines. But all those training opportunities are all available to nurse practitioners. One of my personal friends, her name is Crystal. She is the lead. I think she went to a nurse practitioner to be a midwife. She's the lead midwife in a military hospital, I think in Fort Liberty, North Carolina. So yeah, absolutely. That's all available for nurse practitioners. So great question.
Fantastic. We'll do two more here. So, do you have any say over where you are stationed or what role you are assigned?
Yeah, no, you do. See, that's the one thing too is the military. Yeah, probably back in the day a little more draconian, but nowadays how we do it is we have a system that is an interview system. So in our military, we have our official board file. We have a picture of us, your medals, and then a CV. And you go into a cycle. You can't really like usually you move every 3 years. Now that can be negotiated to 5 to 6 years. The military is getting a little bit more. Hey, maybe we should leave people somewhere more at 6 years. But absolutely, you will interview with different units you want to go to. The military doesn't say you're going here. You have the chance to interview and kind of get there. So for me, out of PA school, I wanted to go to Hawaii, and I asked for Hawaii, and it was a little bit of interview process, and I got to go to Hawaii. And then for the White House, I was recruited. I was nominated for the White House, and I was able to interview and go. But I wasn't told to go there, and I wasn't just pulled. I still had to interview and prove that I was worthy of that unit. So yeah, you have a lot of say in where you go, and there's always the network you build. There's a huge network in the military, so you can always talk to other people and be like, "Hey, you're leaving this duty station. I want to go to that duty station," and you collaborate a little bit, which is important. That's the whole world of networking, and it's very important. And mentorship. For me, for the younger PAs and even nurse practitioners, nurses, medics, I try to mentor them to help them for their career too. It's also if you want to go to Italy, but it's not best for your career, I might tell you that might not be best for you right now. So there's things to think about. But yeah, absolutely, you have plenty to say.
Excellent. We'll finish up with this one. Are there age restrictions for the National Guard as well?
There are age restrictions. I would have to Google that one for sure, but I want to say it's a little older. I would say for National Guard, it's a little bit more state dependent. If you use that point of contact that I have in the slides, they will get you to the right person to help you out with that. But you can. I mean, I'm 43, still serving, so it's pretty lenient. And there's in the military, we like to say there's a waiver for everything. So when you come in and you have the PA degree, maybe you have your doctorate already, there's a little bit more leeway for you to join because they need your skills. Those are important skills for the military to have.
Awesome. Well, thank you, Travis, so much. This was amazing. And I know Travis put up his contact information. So if anyone has any questions or is interested, the other thing I would say is there's generally, at least in my neck of the woods, there's healthcare recruiters specifically for healthcare professionals. So they're not just generic recruiters, but people like Travis said that know all the incentives, know all the ins and outs of the area, even for different service branches. But thank you, Travis, so much. This was amazing. And I hope you have a good rest of the Saturday.
All right. Thanks so much for your time.